My name is William Walker, and today I want to talk to you about STIs and infertility. An STI is a sexually transmitted infection. There are over 25 sexually transmitted infections. The most common are chlamydia, gonorrhea, and syphilis. These are bacterial infections that can be cured with antibiotics. Other STIs, like HIV and hepatitis B, are viruses that cannot be cured but can be controlled with medicine. HIV infections can lead to AIDS, which will attack the cells of your immune system, leaving you defenseless to other infections. You can experience flu-like symptoms a few weeks after getting infected with HIV. If left untreated, an STI can lead to many health problems with your heart, brain, joints, and cause damage to your reproductive organs, affecting your ability to have children. With the most common STIs, the symptoms are very mild and can be unnoticeable at first. Such as for chlamydia, it causes a buildup of scarring that can block the fallopian tube and prevent fertilization. Did you know there's a test you can take at the Student Health Services located right here at the University of Louisiana's campus? It's called the Soche Wellness Center, located at OK Allen Hall. Their website is studenthealth.louisiana.edu if you'd like to find out more information. A blood sample, urine sample, or mouth swab can determine if you have a sexually transmitted disease. If you are having unprotected sex, then you have a good chance of getting a sexually transmitted infection. To stop the spreading of STIs, you must get tested and continue to get tested regularly. Sexually transmitted infections are caught by having sex with an infected person, specifically having unprotected oral, anal, or vaginal sex with someone who is infected with a sexually transmitted infection. In women, chlamydia and gonorrhea symptoms can include vaginal itching, vaginal discharge, and burning when urinating. The STI infection can cause inflammation of the cervix or urethra. If left untreated, an infection called pelvic inflammation disease, or PID, can permanently damage the uterus and fallopian tubes, reducing your chances of becoming pregnant. Men with STI could experience pain, redness around the opening of the penis, and burning when urinated. If left untreated, the infection could travel to a man's genital tract, damaging the sperm quality, and you become infertile. You cannot treat an STI yourself. You must seek medical help. The Center for Disease Control in 2011 reported over 2 million cases of chlamydia, gonorrhea, and syphilis in the United States. Louisiana has one of the highest rates of STIs. In 2010, Louisiana reported over 38,000 cases of chlamydia, gonorrhea, and syphilis in Louisiana. And in Lafayette, it's reported over 1,300 cases of chlamydia alone. The Center for Disease Control estimates the undiagnosed and untreated STIs will cause about 24,000 women in the United States each year to become infertile. To avoid getting an STI, you should only have sexual relations with only one partner who is not infected with an STI. You need to use latex condoms every time you have sex. If having sex with more than one partner, you need to get tested for sexually transmitted infections. There are websites online that make it more private to get tested for STIs. You fill out the information online and then report to a lab for testing to get your results online. This gives you more of a privacy. If you test positive, then they will provide referrals to get the right medicine. Get tested. It could save your life.